all of you. And thank you, Randy, for inviting me. I have worked with Head Start, Early Head Start until just 2 weeks ago, actually, at Oneida for the last couple of years as their mental health consultant. So a little bit about me, as Sherry said, I am a clinical psychologist and have been stationed with Indian Health Service for almost 12 years. So I have been a staff psychologist and a behavioral health director, director of training. I started at the Zuni IHS Hospital, kind of in the Four Corners area of New Mexico. I worked on the Alamo Navajo chapter of the Navajo Reservation for 3 years. I was behavioral health director for the Klamath tribes in Southern Oregon for a couple of years. And then just until 2 weeks ago, I was a psychologist at Oneida for almost 5 years. So just recently moved, if people are familiar with the HHS organization, HRSA, these are the folks that do your community clinics. So moved to that position, and my family and I are moving to Dallas in a couple months. So a little bit about me. When I was on the Navajo Nation, I also worked with Head Start, Early Head Start. So have always really enjoyed working with families and with staff that work with young children, especially 0 to 4. So I will, what I wanted to do today is, instead of give you a PowerPoint presentation, you'll see a bunch of links in your chat box. And Sherry said she already saved those links. But I want to just go through resources with you, some local resources for the state of Wisconsin, as well as some national resources. And I'm not sure what professions I have on the call, but some of the resources are for mental health clinicians, some are for medical providers, and some are for people that work in the community with early childhood. So I'm just going to share my screen, if that works for everyone, and just work through, we're going to go through an overview of not only postpartum depression, which is the most common symptom, but I want to review what we call perinatal mood disorders. And all that means is that these are mental health symptoms that can be during pregnancy up until a year after pregnancy. And so the most common is depression, but I want to share with you other symptoms as well, just so that you are aware, and can families that you're working with, that you could get them the help they need. And then I'm hoping to finish at least 15 minutes before the hour, so that we could just have some Q&A, or people could share their experiences with one another. Okay. So here's my share screen. And I'm assuming you can see my screen now.
Yes, we can.
Okay, good. I want to move this out of the way so that I can, there we go. Okay, so many of the resources that I'm going to share with you today are either from national organizations like the American Psychological Association, as well as many of the federal programs that support maternal child health. And I wanted to start with the National Institutes of Health and their Moms Mental Health Matters. And the reason I want to start here is I feel like this website does such a nice job of not only explaining some of the symptoms to look for depression and anxiety, but also we're going to go through risk factors and how do we help people prevent developing some of these symptoms. Okay, so a little bit about what depression and anxiety are. So for many, and when I talk about postpartum depression for the next couple minutes, what I really mean are these ideas of perinatal mood disorders, meaning if you're working with pregnant women, as well as women that have had their babies. So it is very common. The data shows us 1 in 7 women experience some sort of postpartum depression. And many young and new mothers, the type of depression that they experience that's postpartum depression has an element of anxiety to it. And those of you that are on this call that are probably better experts than I am working with new parents understand some of the common sense reasons why that is. That there can be a lot of anxiety around taking care of a newborn and making sure that you're doing everything quote unquote right. Okay. So, what are some of the signs of depression and anxiety that you might see in women that are pregnant, feeling sad, or angry without warning? So, that's an important one to remember because oftentimes when we think about depression, we really think about people feeling down or low, sad, crying a lot. But people can also be extremely agitated and irritable. And that symptom can also express itself as depression. So really paying attention that if your moms are experiencing a lot of anger. So foggy or having trouble completing tasks. Really, this is not necessarily that people have ADHD, right? This isn't that case. But part of depression is that it's very hard to concentrate and it's very hard to think clearly. And so maybe your moms will explain it that way. Feeling robotic or numb. So just feeling not in touch with their emotions is also a symptom. uh, Very anxious around the baby and other children. And so I mentioned that earlier, just this idea of fears, some of them kind of predictable fears, but when we move into symptoms that we're actually going to treat, meaning that we're going to refer your mom to a healthcare provider or to a mental health provider, that these aren't just kind of your common fears, but this is like severe anxiety. Guilt and like they're failing at motherhood. So part of depression is connected to perfectionism. And so some of our moms, and I'm going to talk about moms a lot, but just so folks know, um, fathers actually can experience postpartum depression and anxiety as they adjust to being new parents, or maybe a same sex parent that didn't birth the child can also have anxiety and depression. So it's not just bio mom, but I'm going to, for ease, I'll keep saying mom. Uh, but moms that are feeling like I have to do all of this perfectly can end up feeling guilty. Like, okay, I thought I was going to keep everything sterilized, but I'm just too bloody tired to actually do it. And I let that binky fall on the floor and I just gave it back to her, but then experiencing a lot of guilt around that. And then again, this irritability and anger. Also, little interest in things that you used to enjoy. And so that's another sign of depression is if you're working with moms that pre having their baby, they had things that they really liked doing, whether it was sports or things with their friends or their work. And that just, it all feels kind of blah right now. Like none of it feels enjoyable. And then finally, what we have with severe postpartum depression are scary or upsetting thoughts that don't go away. And we'll talk about this, that some of the most severe symptoms of postpartum depression are having thoughts of hurting or killing yourself and thoughts of hurting or killing your baby. And so these thoughts, we absolutely, at this point, if a mom is sharing with you that she's having any of those thoughts, part of your role can be to help her know that she's not quote unquote crazy and that she's not a quote unquote bad mom, but that she's experiencing a mental health symptom that can be part of the postpartum experience and that it is treatable and that we can get to her to help. Because the more you can provide education around this and get moms ready for the potential to be depressed or anxious, including feeling suicidal or homicidal, and the more you talk about it without stigma attached to it, the more likely then that mom will tell you when things are going south really quick. Okay, so why don't I just stop there for a second And then, does anyone have any thoughts or questions yet? Okay, hearing none, I'm going to just keep moving on. So it talked a little bit about how common depression and anxiety are during pregnancy and after birth. This is 1 in 8. The data also shows 1 in 7. I think we have a hot mic, so if someone could mute their mic. There we go, perfect. And so anxiety during and after pregnancy is as common as depression and may happen at the same time as depression. So most of us are most familiar with the idea of postpartum depression, but you really do want to watch for moms that are also feeling incredibly anxious. You may feel like you're the only person in the world who feels depressed and anxious during pregnancy or after your baby is born, but you are not alone. And the reason I'm giving you these links versus a PowerPoint is you can share these links with moms. These aren't just for providers or people that work in the field. This is really a way to get information out to your families. Okay. So what are the risk factors? So since you are often working with moms during their pregnancy and doing a lot of assessment and evaluation in your programs, you could be looking for some of these risk factors. Risk factors don't mean that you are absolutely going to develop depression or anxiety in the perinatal phase of your life, but it just means you're at higher risk. And so being more aware and giving those moms even additional education and getting them prepared is a great way to prevent these symptoms. Okay, so here are some of the risk factors. A history of depression or anxiety, either during pregnancy or at other times. So if you're working with a mom that's already in the past been treated for anxiety and depression, that is a risk factor. Family history of depression or anxiety, there is a biological or genetic component to depression and anxiety, and so family history does make you at higher risk. A difficult pregnancy or birth experience. So this just feels like common sense, right? Like if things didn't necessarily go smoothly during your pregnancy or during your birthing experience, then there's the potential for you, especially anxiety, to feel some additional sadness or anxiety. Giving birth to twins or other multiples, and that is just because those experiences in your environment of being overwhelmed can be risk factors for depression and anxiety. Experiencing problems in your relationship. So since I don't know all of you on the call, maybe I will just talk specifically about my experience between Randy and I at Oneida and Early Head Start, and doing her caseload has all the prenatal moms. But usually knowing ahead of time what the relationship is with the partner, and if it's a strength or if it's a challenge or if it goes back and forth between the two. And I would be remiss to not also explain that looking at either parent having any sort of addiction issue, including the partner, can definitely increase the risk for depression and anxiety. Experiencing financial problems. It's just an underlying stressor that makes it really hard to cope in general. And especially if you're bringing a newborn into your home and you want them to be safe and you want them to be cared for. If you're having a lot of financial struggles, it can increase your risk. And then receiving little or no support from family or friends to help you care for your baby. Whether maybe you have moms that don't have strong relationships in the community or with their family. Or maybe you're working with a military family and you've got a young mom that lives far away from her support network. And then unplanned pregnancy. So again, does not mean that your moms are going to end up with depression, anxiety, but the more of these that you might tick off as you're evaluating a family, the more you want to help that family get ready for possible postpartum depression. Okay, can depression and anxiety during pregnancy or after birth affect my baby? So the answer is yes. And so it's not necessarily directly, and at the end, we're going to look at uh, a bonding resource. But when a mom is depressed and highly anxious or having even more mental health symptoms or potentially struggling with their addiction, um, what what the challenge is and how it affects the baby is that those symptoms oftentimes make it harder to bond. And so, really helping your mom get treatment for her symptoms early on can really then help the mom with bonding. So, postpartum depression, anxiety, postpartum, what we call, I'm going to show you in a minute, what we call psychosis, which means that you can hear things other people can't hear, or see things other people can't see. That these are all incredibly treatable symptoms. And oftentimes, the reason they go untreated is mainly primary care, OBGYNs, case managers, mental health people, daycare workers, anyone that's in that family's life. We just don't talk about it enough. We don't let families really work through their birth plan of how to get help. But once these symptoms are identified, they are incredibly treatable. So here are the different types of treatments, mainly like coming to Oneida Behavioral Health. And so being able to do talk therapy or counseling. Some moms do need medication. And so, especially if they're having severe symptoms. And so, if you refer them to a mental health clinic or a mental health provider, that provider should then also assess how to get them a medication evaluation, as well as I'm going to show you a program in Wisconsin that helps primary care providers get moms on medication. So, what else can moms do, or dads, or co-parents do in addition to treatment? We know that connecting and not feeling alone really helps. It really helps moms not feel that stigma of experiencing mental health symptoms. The next one, of course, is a little hard, especially if you don't have a support network, but taking time for yourself. So, um, the maybe one of the goals then, if you have a mom with postpartum depression, anxiety, is helping her build up her support network so that she can take some time for herself. Uh, including time for yourself also just means sleeping. So we know that disrupted sleep makes it incredibly hard to manage depression and anxiety, whether you are pregnant or postpartum or just on this call today, not in those categories. And so, really helping people get some time to sleep, including like ideally 5 uninterrupted hours, because you really want to get folks through a few REM cycles so that they can have some deep sleep, incredibly restorative. Uh, do things you enjoy. This realistic piece and managing expectations, this is really important. Oftentimes, and you guys could probably all give me examples of this, especially first time parents. But just if you have a parent that's kind of wound tight to begin with, doesn't necessarily have an anxiety disorder, but is very perfectionistic, helping them be realistic about what is and isn't manageable and normalizing that can go a long way. Helping moms ask for help. I already talked about rest, right? Just resting. Being in community. So, having a newborn and an infant can be incredibly isolating. And so, if there's ways, at least like Head Start, early Head Start, if you have a mom with postpartum depression, anxiety, they might be someone that you're spending extra time really trying to get them to come to the socials. And seeking out other adults that can provide comfort. So, who are other people that can support you in this parenting process? And then, can we prevent postpartum depression anxiety? No specific way to prevent these symptoms because some of depression, anxiety that happens in perinatal phase of life is very biologically driven, meaning such a significant change in hormones. And so there's no real prevention for that. Like your body's going to do that whether you like it or not. What you can do is oftentimes prevent the severity of symptoms. And so if you catch these symptoms early through screening and you help people get the help they need sooner than later, then we can oftentimes manage the severity. Okay, so I'm going to stop sharing for a second because that's a lot of me talking at you, and see if anyone has any comments, questions, thoughts.
And feel free to either unmute yourself, or if you want to, if you prefer to type in the chat, that works as well. We'll monitor that.
Hi, ladies. Can you hear me? This is Candy.
Yes. We can. Hi, Candy.
Hello. So my main question, and I'm not sure if you have any of the current resources, but I was kind of bummed to hear in my breastfeeding education that they no longer include breastfeeding that is proven to decrease depression. And it always was in the literature. You know, we talk about it decreases ovarian and breast cancer, helps with cardiac disease, and then all of a sudden postpartum depression came up. So I didn't know if there was new research that showed that it did not have an effect, because that was really a good protective factor for the clients, you know, that I work with. So,
you know, Candy, that is a great question. I haven't personally seen anything come across recently, but also just full disclosure, you know, perinatal mood disorders aren't my, you know, expertise, meaning that that's the only thing I work on. And so there's probably research out there that I haven't read. I'm happy to take a look, you know, just do a little survey since I know where to find you at Oneida. And send that your way. What I can say is that we do know that helping mom and baby bond is a protective factor. And if breastfeeding also then connects to bonding, you definitely could present that, you know, that bonding with your infant is a protective factor against postpartum depression.
Yeah, because I teach childbirth education. We talk about hormones in labor and delivery, and those same hormones, you know, are in breastfeeding. So I was just really kind of shocked at, wait a minute, we're still producing endorphins and oxytocin, which make, you know, our mood better. So yeah, I was just kind of a little disappointed. I think that's from the lactation world that's coming from. And yeah, I just was looking for more updated research. It's on my to-do list, but didn't get there.
Okay, well, if I see anything, I'll send it your way. How's that?
Yeah, thanks.
Good. Okay, I'm going to share my screen again. And there we go. And then I'm not going to go over in as much detail because, you know, the time goes by really fast, but I just want to show these to you because they're in your chat box. And I want you to know that these are additional resources. So very similar to the information that I gave you from the National Institutes of Health, the CDC also has a reproductive health section. And so there's, as you can see on the left-hand side, there's tons of information just about reproductive health in general. Oops, see, I clicked on that. But specifically what I wanted you to see is that they do have a page on depression during and after pregnancy. And very similar to the information I just shared from NIH, it's just another way that you could print out information for your families. So again, symptoms, it's common and treatable. And then the nice thing that I like about the CDC is what it does is it gives you other community resources and how to learn more about mental health. And so you can see that they're linking to NIH because what I just went over before was Mom's Mental Health Matter. So just want you to be aware of that. Again, another resource, these are, and the reason why I gave you this resource is because this information from the American Psychological Association also can be downloaded, printed off in color as a 2-pager as a, so if you wanted to have educational materials for your families, I just thought the APA link was very good. Okay, so let me then, so this Mom's Mental Health Initiative, the main website, let me click on this real quick so you can see what the main website looks like. This program started out in the Milwaukee area, and you can find out their story here, but there's all sorts of support, including online support. So even if your families aren't in Milwaukee, there's just really great resources on this website. And then this is a nice screening tool. You do not have to be a behavioral health or a primary care provider to look through these symptoms, but we focused a lot in the last 20 minutes on depression and anxiety, those being the most common, 1 in 7, 1 in 8. But I did want you to know that these other 3 symptoms can show up as perinatal mood disorders. And so obsessive compulsive disorder is that's what OCD stands for. And so again, the reason why you want to be looking at these symptoms is that moms that pre-pregnancy or pre-birth didn't have any of these symptoms might develop them. So, so you just want to be on the lookout. Okay. So OCD, the main thing to think about obsessive compulsive disorder is that the thoughts that you have are unwanted, meaning they're intrusive, and they really scare moms. And so if and moms that have a lot of underlying anxiety are more at risk of developing OCD. So if you have a mom that has kind of a bizarre intrusive thought that the cat is gonna scratch the baby and they're gonna die of an infection. Now, if you don't have OCD, that thought might come into your head as a new mom because you're super protective and you don't want anything to happen. But if that thought is constantly in your head and you don't want it in your head, and maybe you don't even own a cat, that's that compulsive piece. And it's very disconcerting. It terrifies moms. Even though it's very scary, oftentimes, again, sounding like a broken record at this point, but moms will not tell you this stuff. And mainly because they don't want to be seen as like that something's wrong with them. And so the other part of obsessive compulsive disorder, again, more perfectionistic people are at higher risk when they have an infant, is then compulsive behavior. So you have these compulsive thoughts, but then you have compulsive behaviors. And some of those you probably know just from, TV movies that if someone has a lot of compulsive thoughts about germs, then they might have a lot of compulsive behaviors around hygiene or keeping everything clean. And you can see probably in the last year, moms that had either kind of perfectionistic tendencies or already were having a lot of anxiety, and then they had their baby during COVID. You could see how some of those risk factors could lead a mom into feeling like they have OCD. So if your mom is describing any of these symptoms, these are absolutely symptoms that need to be treated past just like support groups. And so you really want to do a referral. Okay. PTSD. So some of our moms that we work with have a history of experiencing traumas. And if you've had traumas in your life, and most women have actually experienced a trauma in their life or multiple traumas, it doesn't necessarily mean that you have PTSD, which are these bullet points of like what the actual symptoms are. But with the hormone changes and the adjustment to a new baby or pregnancy, then someone that has a trauma background definitely has higher risk of developing some PTSD symptoms. You also want to watch for PTSD if a mom had a traumatic pregnancy or a traumatic birth experience. And so, if there was a major medical complication or things like this, you want to be watching for these symptoms. If a mom, unfortunately, is connected to a partner that's not safe, right, or there's some sort of domestic violence. So you really want to be watching. Again, if moms are having PTSD experiences, referral is incredibly important so that we can get those symptoms treated. And then that last one I already shared with you. This is much more rare. Okay, so we have 1 in 7 or 1 in 8 moms that experience depression and anxiety. We have 1 or 2 in about 1,000 moms that experience psychosis. And the best way to describe psychosis is that you feel like your brain is playing tricks on you. So you can see things other people can't see or hear things other people can't hear. Most moms that have these symptoms have what we call auditory hallucinations, meaning they hear things other people can't hear. And what it can do is make you feel really paranoid. And so if you have a mom that's starting to present and act in bizarre ways, or you notice that they are responding as if someone is talking to them or something is happening in the room and you don't see anything or you're not talking to them, these are really important symptoms. You want to act on these like ASAP. Okay, maybe even calling your local crisis center. And the reason is because the type of psychosis that some moms experience has a hallucination that's very specific that we call command hallucination, meaning this voice that's your brain is playing a trick on you, is negative, critical, and telling you to either hurt yourself or hurt other people. And so when moms have this symptom, what usually is happening is there's no underlying what we call thought disorder, meaning the mom probably doesn't have schizophrenia unless she was diagnosed before she was pregnant. What's probably happening is she's experiencing severe depression. And one of the ways that depression presents itself when it's severe is to have psychosis. So this is the most extreme symptom. It also is the most high risk symptom for something tragic to happen either with their child, their family, or themselves. And so what I encourage people to do is, again, to reduce stigma around this, is to integrate this into your education programs. So as you're doing programming that helps moms get ready for all of the joys and all of the excitement, but also all of the challenges, mentioning this just to let folks know this is an incredibly rare experience, but if you have it, please tell me, and educating partners too. Because usually what will happen is a friend, the mom's parent, their partner, someone close to them, a sibling, will notice something's off. And so you want to get that education out, not just to the mom, because the other thing with psychosis is that we don't do a very good job with reality testing, meaning that moms that have severe psychosis, they kind of lose track that it's actually happening to them. And so you really want support people to know about this symptom as well. So once again, I'm going to stop sharing my screen for a minute. Any comments or thoughts? Experiences that you folks have had? I see a few things in the chat. I'm going to just open it up. Okay. Anyone that's had to, yeah, go ahead.
Question.
Yeah.
How would you encourage or support someone who has experienced postpartum depression before,
Mm-hmm.
if they tell you that they want to become pregnant again,
Mm-hmm.
but are too afraid of experiencing what they have gone through previously?
Sure. Great question. Great question. So a couple things. I would work with them in the idea of a future pregnancy, in some ways knowing that you had previous postpartum depression helps us monitor while you're pregnant, not just once you have the baby, and see if you're developing symptoms, and to come at it from a bigger team approach. So normally your team is mainly, most moms in the States have a primary care provider, an OBGYN, and that's kind of their team, But I think many of you on this call, you're expanded part of their team. So making sure that they are in mental health counseling or addictions treatment or both if they need to be, as they are thinking about becoming pregnant. And building a stronger team with their primary care or their OBGYN. And your question, it's perfect because it'll lead into the Periscope project that the Wisconsin College of Medicine has going, that you could even be an advocate for this mom, maybe even going to primary care appointments and sharing the Periscope project, because what it is consultation with psychiatry if their provider, their OBGYN or their primary doesn't feel like this is their expertise, but it's a free consultation service to that primary care provider to follow the person's mental health throughout their entire course of pregnancy and postpartum. And so those would be my main things. Again, it's totally up to folks, but helping them with a cost benefit analysis, that if they really want to have another child, that if they want to go that route, then let's make sure that your team is really strong as you're going through this. Does that help?
Yes, that helps a lot. Thank you.
Okay. Yeah, good. Let me share my screen again and I'll show you this Periscope project. Okay.
Okay. Thank you.
Okay. Share. Okay, we're back. Let's see. Well, I need to move this out of the way. How do I move this? Because it's in the way of my, oh, there we go. Okay. So let me see which one I've got. I wanted to just show you the generic one. Okay, here we go. This is in your chat box, okay? But the Periscope project connects providers to perinatal psychiatric specialists. It's free of charge. This is for medical providers to use. So it's an 800 number, and 3 services are available: psychiatry consultation, educational presentations and tools. So you could reach out to these folks and maybe come to your clinic if you're like Candy working at IHS, right? And community resources in Wisconsin. So suicide is the second leading cause of death among postpartum women. And that's because postpartum depression is so common. And so this whole project, the whole idea is to, just like I was saying, just expand the team of people that know how to treat perinatal mood disorders. So the thing that you can help your client with is that their primary care provider or OBGYN, if they call that 877 number, they're going to get a perinatal psychiatrist calling them within 30 minutes. You could even put your mom in the waiting room and wait for that consult to come back. The provider continues to care for the patient. And so the nice thing about this is those of you that have folks that you send all sorts of good referrals, but maybe that mom's overwhelmed, maybe she works second shift, maybe there's a bazillion things, maybe she's got a bunch of other kids, and just isn't willing to go to that one more appointment. The reason why this project is so powerful is because it keeps the care at OBGYN or primary care, but it also addresses the psychiatric needs of the patient. And so this is the project, but then I also want to show you there's tools on this website for you as well, not just providers. So here are some ideas, and you can print these off, of talking about depression and anxiety during pregnancy and after birth, and the ways that you can help and providers can help. And you're probably doing all this already, but you could print these posters and put them up. You could do advocacy with the main, whether it's a community clinic or an IHS clinic, a tribally run clinic, to advocate, maybe even do a little presentation with providers about, listening, offering support, and offering help. And so here, this handout gives you nice information about these are some of the things you want to look for. Leading signs. Yes.
This is Candy. I learned about the Periscope project quite a few years ago, and like you said, it is a very powerful tool or contact. These individuals, specialize in, pregnant women and what's safe. So we have Oneida here at the clinic. We have Prevea providers that come. So any new resource, I definitely share with them. So they know about it, and I hope they utilize it. So just wanted to let you know.
Thank you. That's fantastic. And that's a great example of how a lot of this work is, you're kind of the first line, because moms probably talk to you more, you have more time with them than their providers, and linking them to the services they need. So the other, I thought this was a great form, is here's an action plan for depression and anxiety around pregnancy. You can print this off for your moms. So it tells you, the green is like the baby blues, basically. And normalizing, hey, this is normal, but you're in the green area. Now, if you're experiencing these things down here in the yellow, then you may be experiencing postpartum depression or anxiety. These types of feelings, once we're in the symptom category, when we're in yellow, they don't go away on their own, or usually they don't go away just from like what we call natural supports or community supports. So you really want to help that mom get services. And then here's the red. So this is these feelings of suicide, right? Hopelessness, feeling out of touch with reality, that's that psychosis, and then feeling you might hurt your baby. So that's what we would call homicidal thoughts. And those situations, you really need to get that person to help without them leaving, ideally your building. So you really want to call your crisis center, call 911, help them go to a hospital emergency room for further evaluation. Even if moms are not very happy with you about this, they are usually incredibly relieved. And even if they present as angry, that underlying feeling is, I feel out of control, and I feel like something bad might happen to me or my baby. And people are noticing and doing something about it. And so just great resources. Okay, I want to make sure that I didn't miss. There's also the Postpartum Support International. Going to keep track of time. Oh, good. 11:46. You might already use this resource, but I've put this in the chat box. Tons of good resources. And so there's a discussion tool that you can use that helps moms track their symptoms. So all these symptoms we were talking about, it looks like this. You can print it off as this download, but you can help them. This is like a little screening tool. I've been experiencing the following symptoms, and they could click the risk factors. And then here are again resources for them. So you've got that tool. These are tools for you because there's all these great awareness posters that all sorts of information that you could post in your agency or at your local clinic that most of your moms go to. So here's this information. You know, fathers can also get depressed and anxious, and helping them with some of those symptoms. An educational DVD, more educational materials. To just look through all of these links. They're in the chat, but here's a nice like infographic about perinatal mood and anxiety disorders, you know, symptoms and risk factors, how you can get treatment. So this poster basically is a summary of that National Institutes of Health, that first website that we looked at. And then I know we're getting low on time, but I wanted to show you that, well, let me show you this first. I did some research, and there's just not enough research in the States, and I am sorry to say that, but more research has been done in Canada with Indigenous moms. But being Native American or Indigenous does increase risk for perinatal mood disorders. This is a nice summary of a study that came out of Canada recently. And I think they do a very nice job of really looking at chronic life stress and trauma, including historical trauma, generational trauma, and some of those things. Whoop, sorry about that. Okay. And just some information about a program that's working with moms and perinatal mood disorders, how discrimination can impact perinatal mood disorders as well. So I just wanted to make you aware of that. And then I wanted to make you aware of the Perinatal Mental Health Alliance. Sorry, let me move this all the way. For people of color, and really focusing on specific challenges that minority moms might experience as increased risk factors. So I think that's all of the links that I put. Yeah, here's your checklist for the Postpartum Support International. I think this is all of the links that I put in your chat, and I will stop sharing now, but I hope that those resources are helpful. I hope those are things that you might be able to share with your families or use as you're advocating for your families as they're navigating other systems, you know, healthcare systems or other social service systems. And I'll leave it open for Q&A or if people have comments.
One of the things I noticed that you said too, and I think this goes along with women.
Sherry, I think you're muted.
I'm still muted? How about now? Still no?
I can hear you.
No sound.
Oh, huh. Well, Candy, you can hear me?
Yeah, I can hear you.
Sorry.
Now you can?
I was muted.
Hear you, Sherry.
Oh, okay.
I was muted. Sorry.
I was like, what should I unplug here?
No. Sorry. My bad.
I was just gonna say, I think a lot of times women feel like they have to be strong, and that it's a weakness to show, or it's not right to show any type of weakness. And when you're just had your baby and there's all these things going on, and so you mentioned reducing the stigma, and I know you said just being honest, talking about it, providing education about it up front. Is there anything else you could say to all of us that we could do, whether we're community members, or working in healthcare? Is there any other suggestions as far as our role in trying to reduce that stigma?
That's a great question. I think one of the things that really helps reduce stigma is stories actually. So we can give lots of good research and we can give lots of good education, but without, disclosing any specific person's story without their permission. But through the years, if you have generic stories of like, hey, I've been working in the 0 to 3 world for 20 years. And, I can think of many clients that experienced postpartum depression. And once they were able to talk about it and get the help they need, that it wasn't a lifelong condition. And really kind of getting people to know that other people have been through this and it does get better and treatment does work. So stories are very powerful. And the other thing that is time consuming, but actually is very helpful is, like I was saying before, a lot of people don't follow through with referrals. And so if you in your role, whether community member or work in the field, and you know that you're working with a mom that's experiencing some pretty significant symptoms, that you are kind of taking the extra steps, whether it's taking a little extra time with the partner or the mom's sister or whoever it is to help with that follow through, or maybe tracking on your own calendar when their appointment is. And if you have the strongest relationship with that mom, like a nice call or a text, just as a reminder, or depending on the severity and what your relationship looks like. I know like the early Head Start folks like take moms to appointments. And so even helping, even if they don't necessarily need the transportation, but they need that little bit of a push to get to, a mental health appointment, that goes a long way too. Yeah, great question.
I have another question.
Yeah.
What would you say, and maybe based on your experience, I have a lot of women, saying, I don't want to be on antidepressants for the rest of my life. I don't want to take them forever.
Yeah.
Do you see a happy medium? Is it something that they may not always need?
Oh, absolutely.
Yeah.
Yeah. And especially for perinatal mood disorders, because some women will experience these symptoms mainly because of biological reasons, right? Hormones and other biological predisposition. And so the other thing, even if it's not a perinatal mood disorder, just antidepressants in general, there are some mental health symptoms that we consider more lifelong or chronic. And many people have to take medication for the whole life. And those are really neurological disorders like ADHD. We don't cure people from that. They might take medication their whole life. Bipolar disorder, so might have to take mood stabilizers their whole life, or thought disorders, so people that need to take antipsychotic medication. But people that experience depression and anxiety, and especially if it's situational, is that these are not chronic conditions. These can be what we consider acute conditions, and meaning that it has a beginning, a middle, and an end. And that lifelong depression or medication for it doesn't necessarily have to be the outcome.
Yeah, I definitely see that as a barrier for a lot of my clients.
Yeah.
They think they're going to have to take it every day. And I think that's just lack of education and awareness that, like you said, situation kind of let us help you get through this difficult time with medication and counseling. And
that's right.
More than likely you'd be able to take the taper off and be okay on your own. So
yeah, and the other thing that you can help folks with, and their therapist should be helping them with as well, is that first NIH website, all the other things that you can do in addition to treatment. So you can help that mom and say, hey, the more that we beef up these protective factors here, meaning you're less isolated, you're getting rest, you are doing things you enjoy. The more we increase those, the less, medication and therapy is likely going to be indicated in the future. And so that helps moms feel some control over their life and their symptoms. That's a great question, Candy. The other thing too that you folks are great at, because you have the relationship with folks, is when you're hearing things like that, we are so still trained in our society to not ask our providers questions. So especially our medical providers or people that give us medicine, but even our therapists. So you can advocate, coach, train, even practice, rehearse. Hey, the next time you're with your therapist, you have this question. Why don't we work on asking it? Maybe you even want to write it down so you have it written down when you go to your next appointment. And really helping them be their own healthcare advocate. I see 2 minutes left, so I don't know, Sherry, if you need to do any wrap up, but this has been incredibly fun. I will, I'm in the chat putting my new email, so if people have questions, feel free to reach out.
When are you departing from Oneida?
I did 2 weeks ago.
Oh,
I still live in Green Bay, but we're working on getting the house. We're moving to Dallas. So working remotely for an office in Dallas. It's a wild world, COVID world, huh?
We'll miss you. Good luck with everything.
Thank you. Thank you.
Don't turn into a Cowboys fan.
Oh my goodness. Never, guys. Never, ever. I promise.
You better not.
She's got blue on already. I don't know.
I know, it's true. Oh goodness.
She'll make sure she wears red, or green, yellow.
That's right. That's right. On my lanyard, right? I got to make sure. Maybe I can get a Packers beaded lanyard before I leave.
Yeah.
There you go.
Yeah.
Well, does anyone else have any questions? You can either unmute yourself or put it in the chat.
This was a great topic. I wish you could do this on a regular basis. It's always a concern for me and my clients.
I agree. And I never feel like I have quite enough information to do what I need to do or to make sure I'm helping as well as I should. So I really appreciate you taking the time to do this, even though you've sort of moved on.
Yeah, well, and reach out, because if I can even, send resources in the future or answer specific questions, please put me in your back pocket.
Excellent. Always good to have those resources. I was going to let everyone know too, I have the links in a document that I will send out to who attended. So if you aren't seeing them in the list or in the chat, we will send those out too. So yeah, amazing resources. I think that's another thing we all need to have in our back pockets. And I love when there's things we can use, print out and share. So I really appreciate it. Well, I will wrap up and thank you so much again for your time. I think this was just a perfect topic, and how we ended up getting you for May when I didn't even realize it was Mental Health Awareness Month, but it worked out well.
That's great.
And I will share Dr. Trail's new email as well with the resources. So as she's already invited us to reach out if needed. So
absolutely
definitely do that.
That's great.
All right. Well, thanks again, everybody.
Thank you,
We
ladies.
want to come to Texas, actually.
Oh, yeah.
Yes. Open welcome, Randy. Talk to you later, everyone.